Hi, this is Patty Gilbaugh, Director and Founder of Mae Advocate Center. We're shooting today with our animals because animals are oftentimes the emotional supports that we require to overcome trauma in our life. They bring us a lot of comfort and add to our resilience to get through difficult times. Today's topic is PTSD, or post-traumatic stress disorder. PTSD is a serious condition that requires professional help, and we encourage you to get it as soon as possible. The disorder itself is not something that's organic or what you're born with. It comes from having an exposure to a life-threatening or very stressful event in your life. It's a context type of mental health problem. It's important to note that while PTSD is commonly diagnosed in war veterans and sometimes in violent criminal activities where there's victims who are dangerously assaulted, but it can also happen in significant life events, such as surviving a car accident or a near-death experience. Some of the most disturbing trauma events that people experience involve sexual assaults and domestic violence. Some of the symptoms that we experience from PTSD include nightmares or flashback memories, night sweats, sleep disturbance in general, an inability to hold or want to have conversations with people. It disrupts and strains our relationships with people. It also makes us more vigilant and fearful in life in general. Each person has their own type of response to stress events, but with PTSD, these symptoms persist for at least 6 months or longer. It's important to note that PTSD and trauma events increase the production of cortisol in the brain. This is your stress hormone. An overproduction of cortisol causes all kinds of mental fog or lack of concentration, or the inability to hold down a full-time job in a meaningful way. The impairment to daily life is significant and profound, which is why we encourage you to seek professional help. With the right kind of therapy, there are things that you can do and strategies that you can implement to help you become a more productive person. Most medications do not actually treat PTSD. Treatment of PTSD requires cognitive interventions. So cognitive behavioral therapies, narrative therapy, and EMDR, which is eye movement desensitization and reprocessing, those specific types of modalities of treatment are very helpful in overcoming PTSD and becoming a very productive or otherwise normal type of person again. Here at Gracie Mae, we do all types of trauma-informed therapy. With children, we incorporate play therapy techniques, and with adults, we use all kinds of different types of therapy, including EMDR, but also narrative therapy and trauma-informed care. There are different types of play therapy, but probably one of the most beneficial is actually called filial therapy, which is where we train the parents how to become the play therapist at home. This trauma-informed type of care helps children feel safe and can build lasting relationships and have trusting, nurturing adults to help them process what happened to them. Trauma in children occurs much more frequently than what you could imagine. The smaller a person is, the younger a person is, the less it takes for them to feel an extreme amount of stress. Sudden disruptions from home, losing your primary supports, getting involved in legal matters such as a custody dispute, those types of things can cause trauma or extreme amounts of stress in children, and they'd have many of the same symptoms that adults would have. However, children would also have some behavioral symptoms, such as having tantrums or feeling uncomfortable in adult or new situations. But also, you might see some disinhibited types of behavior as well. So for example, going up to complete strangers and offering hugs or offering affection to them. For children, we want to really pay attention to how our stress and the things that the adults are doing around them affects our youngest persons. We want to make sure that when things are going well, we're touching base and getting a baseline so that we know the changes and we can recognize when things are more stressful for them. Stress on a daily basis is something that we can't avoid. But when children are exposed to chronic high levels of stress, it can have a long-term consequence in their ability to function not only as an adult, but we now know that trauma alters our DNA and they can pass it on to their offspring. It's hard to imagine what life can be like after you've had the symptoms of PTSD for a significant amount of time. We want people to feel happy. We want them to feel healthy. We want them to have a strong support system. And by working together, we're hopeful that you can return to the way you were before the traumatic event. In the case that that's not possible, then we help you find a new sense of normal and build a new resilience for your future. That's all we have for today, and thanks so much for joining us.